value the physical so much. Let me put this in terms you can understand.
Oh my lord, I thought we were reacting to House, not the Oscars. Very excited to react to the season 2 finale requested by Amar Beget, our second ever channel member. This will be 24 out of 177 House MD episodes. I'm going to react to them all. Let's see if I can get the diagnosis before House does.
Which one of you is House? I was a patient of yours.
Well, if you want to leave the chocolates downstairs.
Stay away from it. Who'd want to hurt you?
What? The way he was shot in the middle of telling him to leave the chocolates downstairs. I felt that. This might seem like fiction, but patients attack and even kill their doctors more frequently than you might think. In 2019, the British doctor Phillips was attacked with a crossbow after a patient said that he had killed his father. When you're dealing with people's lives, things can get sour very quickly. And that's why we always try to be careful with procedures and managing expectations for them. Medicine is definitely a roller coaster. Now, what are House's chances of surviving this gunshot wound to the head? 2016 study showed that non-military victims had a 42% chance of survival of a penetrating head wound. So it's pretty much 50-50.
The bullet to your abdomen pierced your stomach, nicked the bowel, lodged in the posterior rib. The one in your neck
I don't remember that one.
went right through, severed your jugular.
You may think House is unlucky here, but at least modern medicine could put him under anesthesia and fix him up with IVs. I remember reading a case of a 12-year-old boy from 1923 who was in an automobile accident. He went through a windscreen and began hemorrhaging. The family immediately applied pressure to the wound and drove him 4 miles to the nearest hospital. On the way, they stopped to speak to a doctor who waved them on urgently to go to the hospital. As he got there, his head was held up, as when he let his head back, the bleeding would restart again from his neck wound. The doctors in hospital realized that he'd severed part of his carotid artery and jugular vein. He was anesthetized with ether, which is an extremely flammable antibiotic. They fixed up the wound and the patient was still not looking too great. So they gave him 500 cc of salt solution and coffee via the rectum, since IV lines weren't quite in widespread use at that point until the 1950s. Voila, he perked up at once. Oh, the good old days.
The shooter turns out to be a guy who...
Don't care.
You don't care why a guy walked into a hospital and shot a doctor? Shot you?
I assume his reasoning was faulty.
I love the stoicism that House is showing here. It's an ancient philosophy that makes a lot of sense. It was first proposed by a Greek guy called Zeno, and it focuses on the circle of control, stating that we shouldn't focus on things that we can't control. It allows us to use our energy to worry about things that are more likely to be of benefit to ourselves and society. Interesting insight into House's character here.
I got shot. Diagnostically boring. Big fat tongue, on the other hand. Endlessly entertaining.
We biopsied his tongue.
It was negative.
Alright, so we found our patient for the episode. Swollen tongue with fever and negative blood tests with a biopsy are what we have so far. The team are thinking either toxins, allergic reactions, or infection. To me, it seems like he has something we call glossitis, and the most common causes are vitamin deficiencies like iron, folate, or B12. Rarer causes could be antibiotic use, deficiencies like riboflavin or nicotinic acid, and even polyarteritis nodosa, a form of vasculitis. Or maybe he's just using a new toothpaste.
Quit upping your morphine.
I'm not. I'm reducing it. Stomach kills me, my neck is throbbing, my leg feels better. It means something must have gone wrong in the surgery.
I can see House's line of reasoning here. As he had chronic pain, it might be one of the peripheral nerves that was injured during the operation. He knows the path of the bullet that went into his rib, and that doesn't cross any of the peripheral nerves that would supply the leg, so the shooting couldn't be the cause. You may rightly ask, so what? The pain has been fixed, surely that's a good thing. You would be right to an extent, but it's not that simple. It could be that the motor nerves and not just the sensory nerves leaving the leg were injured, and that could cause weakness in what is an already weak leg. It could also be that this is neuropraxia, where trauma inactivates a nerve temporarily and then it regains function. We use that kind of principle that House is talking about to do nerve blocks and regional anesthesia for patients who've tried other types of pain relief that haven't worked, and that can treat really difficult pain conditions. We call that a regional nerve block that the anaesthetist may have done for House during his procedure to help manage his pain temporarily, and it could be on its way back fairly soon. Now here's a question for you smart people. How do local anesthetics stop nerve signals? Put your answers in the comments below.
Why did you try to kill me?
I didn't. I need you to live. Because I want to see you suffer.
Can you imagine putting someone that's just been shot alongside the person who shot them? I remember once I had a 19-year-old patient who had been in a knife fight who was brought in by the police. He mentioned that there were people looking for him, and so 3 police guards were with him at all times. Eventually the rival gang came with 3 people and saw the policeman and ran off. If they weren't there, you can imagine what might have happened. There's a real problem with knife crime in London and the UK generally. I once saw a guy who had a clean knife wound on his arm, which he'd gotten from falling off a bicycle. They usually say that they carry knives out of the fear of being attacked, and police reports actually say that most teens that carry knives aren't related to gangs. So that's the level of protection that's usually needed after just a knife wound, never mind a gun wound. So this situation's a bit sketchy. Although it does make for great television.
Oh, get the needle out of there.
Can't breathe.
The test was negative.
Are you sure you want to be doing this?
I love how House still wants to treat his patient even though he needs to help himself. It makes me think that this is all he has. He's got no partner, no family that are close by, no friends outside of his work colleagues. In a way, treating others is a way that he treats himself, and why he can't go without it even when he's unwell. This is his purpose, is all he has. How can I compete with a man like that for diagnoses, guys? Now, if you like what I'm doing on this channel, we've just opened a channel membership for you to support me continuing to make these videos. The first 10 members get a Hall of Fame spot, which means your name will be etched onto this channel's history forever. There are only 4 spots left, and by joining, you get access to extra perks like being able to recommend series and episodes for me to react to, and early access to new videos. So we're going to do a member Q&A once we fill the Hall of Fame with 10 members. So go press join to secure your spot now.
Almost for sure it's some sort of infection. We've got him on broad-spectrum antibiotics, but it's not even slowing the thing down. And we can't figure out what type because we can't do an LP.
Now, how might an LP help us find the source of an infection? I suppose if he had something like neurosyphilis and that was found, but then you could diagnose that from a blood test as well, which is much less invasive. Also, if you had fungal meningitis or cerebral malaria, Lyme disease, that might show up. Again, that could also be diagnosed from a blood test, so I don't quite see the necessity of going straight for an LP here. Don't know why House hates blood tests.
My wife was sick. None of the doctors could figure out why. She lived. You cured her. I confessed to you that I had had an affair. You also told her about my affair. She killed herself.
Oh, that is heavy, but still, is it House's responsibility? Was he the one that cheated in the first place? It's easy to play the blame game if you're grieving, but there's an old saying that goes like, when you point the finger, there are 3 pointing back at you. Blaming House allows the shooter to play the victim and avoid emotional responsibility. The truth is, though, that until he takes the responsibility, he will always be angry and feel like she was taken from him rather than him having had control over the situation. Tough spot to be in, to be honest.
It's my husband.
Really? 7s marry 7s, 9s marry 9s, 4s marry 4s. But you've got at least 3 points on your husband.
I mean, you can think about relationships this way, and generally it's probably accurate. But even if you're a 10 and you marry a 10 because you're looking for looks, if they haven't got the right moral compatibility with you on the big stuff, then you're in real trouble. Because looks will only have value for so long. Wow, for a moment there I felt like Jordan Peterson. I'm going to put my science hat back on.
He's bleeding into his ocular orbit.
LP wouldn't do this.
Some pressure behind. Gotta relieve it.
Oh, I can't believe his eyeball just popped out. Okay, now this is getting beyond spicy. Now, in the medical world, we call that globe luxation. It can be classed as spontaneous, voluntary, or traumatic. Spontaneous luxation can happen without conscious effort, as you saw here, because you could have a shallow eye socket, medical conditions like hypothyroidism leading to exophthalmos, lax soft tissues of the eye or muscles. Voluntary luxation is when you can protrude the eye yourself by manipulating the eyelid, and traumatic luxation is when you get some kind of injury at high speed that can cause the globe luxation. With him, it seems clear like it's the spontaneous luxation. If this happens, it's so important not to push the eye back into the socket, as you risk damaging the exposed very important orbital structures like the optic nerve and extraocular muscles.
I should go. Soon have torn my stitches.
Collapsed in the hall. Tore your stitches.
Shoot the guy who sold her the gun?
The way House is stuck next to someone he hates just seems like a bad marriage. I don't think any therapist could fix this one though. It kind of reminds me of when I was on cardiothoracics in Manchester and a woman attacked her husband with nothing other than a samurai sword. You may ask, why was he owning a samurai sword in the first place? And he asked himself the same question after. Because it went all the way through his abdomen and up out of his right shoulder. It managed to miss all of his vital organs, but we still had to open his chest while we pulled out just in case anything started leaking, but it was surprisingly easy to pull out.
She locked herself in the garage and she started the car.
You shoot the guy who sold her the garage door opener?
My fault. She's dead. It's maybe just a little bit yours too.
What I find interesting here is that the shooter committed what can be perceived as attempted murder. But not only is he in the room with the guy that he's trying to kill, but there is also no security here at all either. Is this a hospital or an octagon? Actually, it would be safer in an octagon because at least there would be a referee. I find it also interesting that the patient acted impulsively to shoot House and now he wants him to take responsibility. This reminds me of what Chris Voss teaches in his award-winning book, Never Split the Difference. Reciprocity is one of the most powerful human behaviors. Understanding their view, even if you don't agree with it, will generate fertile ground for the other person to hear your ideas. Shooting someone kind of puts a spanner in those works.
You either get to ask for an apology, or you get to shoot people. Not both.
You're referring to the blood-brain barrier.
Biopsy the barrier. First start him on mebendazole in case it's a worm.
The blood-brain barrier is an interesting cellular construct that describes the very selective permeability of the brain's vascular supply to limit the entrance of toxins to our very important brains. This permeability is maintained through endothelial cell tight junctions, pericytes, and astrocytic foot processes. Disruption of the barrier can lead to neurological conditions like Alzheimer's disease, encephalitis, MS, and even brain tumors. Interestingly though, not all areas of the brain actually have a blood-brain barrier, as some need better access to systemic circulation than others, like the pituitary gland, for example, that needs to sense hormone levels and be able to secrete hormones quite quickly. The organs that aren't protected by the blood-brain barrier are called the circumventricular organs. Speaking of being outside the barrier, it isn't like a clear cling film that you can just biopsy, as House is suggesting here. His rationale for looking at it though was that if both the eye and the tongue are affected, then it may be a common focus that is leading to both the eye and tongue symptoms, and the closest thing is the brain, even though the CT head was normal. We still don't have results from the lumbar puncture though, so surely they would want that before sticking a needle in his head to biopsy the barrier. They said the other option was a tumor affecting both the eye and the back of the tongue, but they would have seen that when they were putting the eyeball back into its socket. Now, with the worm, don't ask me where that came from. I don't even think House knows where it came from. He just made it up on the spot. but he'll probably be right just because he said it so casually.
Levofloxacin in case it's an infection that slipped by the first antibiotic.
And azithromycin for STDs.
I really don't think the wife is the kind to be messing around.
The patient isn't married. He's a widower.
What? So earlier, House saw a woman that he thought was too attractive to be the patient's wife, grilled her to make sure she wasn't cheating, and now it seems like she wasn't even his wife? House. I know it's not ideal that you get shocked, but you don't quite help yourself with all the trouble you get yourself into. Maybe the patient's rich and this lady was poisoning him to get hold of his money. Maybe she's his sister and is trying to look out for him. Maybe she wasn't there at all and House just made her up. I'm excited to find out more.
There's only one possible conclusion. It's a hallucination. Why did Gillick give me ketamine during my surgery?
There's a clinic in Germany. They've been treating chronic pain by inducing comas and letting the mind basically reboot itself.
Who wrote the ethics policy at this hospital? Adolf Hitler? They do clinical trials on live babies without consent. They cuff a patient to a bed next to their gunman and they give an experimental chronic pain treatment while they've just been shot. Where are you now, medical negligence lawyers? Still makes for brilliant TV. Okay, ran over. A 2014 review actually concluded that ketamine treatment for chronic pain has been known to temporarily help for up to 3 months. Some side effects include hallucinations, memory defects, panic attacks. House seems to have his fair share of those. Pretty awesome seeing him pain-free though.
You had no right.
To heal you?
You messed with my brain.
Why are you so upset?
It's a point of principle.
Test was negative.
We did find blood.
Blood dyscrasia means cancer.
Find it. Go get lung lymph.
House is angry because he needs that diagnostic edge to give himself value. If the ketamine's causing hallucinations, then maybe that could interfere with his other decision making. Interestingly though, studies that talk about the use of ketamine for chronic pain mention that it should be given as an infusion over 6 to 10 days, not just a single injection like we've seen here. Now, because the blood-brain barrier biopsy was negative, it seems like they're looking to the lung lymph glands as to see if there's something there obstructing the drainage from the eyes and tongue. But by the point that your eye starts popping out, you would have hoped that they would have done a CT chest, abdomen, pelvis to search for any malignancy or cancer. Seems like House is just looking at lymphedema as a possible explanation of his symptoms, although that cannot be true since only one eye is affected, but the whole tongue is affected. You see, there is some shared lymph drainage between the eyes and the tongue, but would be at the level of either the deep cervical lymph nodes or the thoracic duct on the left, and the right lymphatic duct, well, on the right. So if there was a problem on the left side causing the tongue and the eye swelling, then technically it should only be affecting the left, but it's affecting just the left eye and it's affecting the whole tongue. That means it's not lymphatic. I would be going with an invasive thyroid cancer here, possibly producing the exophthalmos and impinging on the tongue's venous drainage. Not sure why they haven't just scanned him yet. Scan the man before you stick another needle in him. There's been 3 in this episode so far.
Test was negative.
Showed no cancer.
What are you? Getting aroused?
Chaser always seems to pick the short straw or get sprayed by it. To me, it looks like this patient has spent too long sparring with a Dagestani, especially now he has scrotal bleeding. Another possibility though is he could have Behçet's disease, which we so eloquently remember as can't see, can't wee, can't climb a tree. If that's true, then the next symptoms would be erythema nodosum or a leg rash. The disease mechanism is quite poorly understood, but we know it's a type of vasculitis, and treatment would be with steroids or immunosuppressants. Here's a question for you smart people. What are the main side effects of steroid medication? Whoever lists the most gets a shout out in the next episode.
Has testicular cancer.
You don't catch testicular cancer early, it kills.
Question is why I didn't think of it.
Eyes popping out is a rather odd presentation.
Caught it early. Caught it early. If it is cancer, it would be so advanced that it spread to his eye socket and blew his eye out, and we Caught it early! The oncologist, ladies and gentlemen. I have to say though, if they'd just done the scan, they would have seen that it could be a cancer that had spread. Now if it is, they need to remove the affected testicle, check the tumour under histology and see what chemotherapy could use for the other sites that are affected by the tumour, since the tumour cells would be in the blood and simply cutting out all the satellite tumours wouldn't get rid of the cancer. Could still be Bechet's though, to be fair. This is a tough one.
I've known what you did for 6 hours. How come you're acting like you've known for days? What do I have? I have my brain. That's it. I can make people better. And you two decide to train that for jogging shoes.
House has swapped his physical pain for the existential pain of feeling like he can't contribute, because ultimately, as 20th century psychologist Alfred Adler says, happiness is a feeling of contribution. See, I can relate to how House feels here, as throughout my undergraduate years, I was all geared up to be a surgeon. I had publications and set up regional teaching programs with a shiny CV all ready to apply for training. When I decided it wasn't right for me, I felt lost. Like, what am I going to do with my life now? It's part of the reason why I went all in on this channel, so I could contribute to the world in some other way. I didn't have a direction for a while, but now I've been handed a sat-nav, so I can relate, House.
I value the physical so much. Let me put this in terms you can understand.
Oh my lord, I thought we were reacting to House, not the Oscars. This is ghost pepper levels of spicy. House seems to have totally lost it because of the ketamine. I understand his frustration, but you also need to take their intentions into account, and they meant well.
But you're hallucinating. You were calling me Wilson.
No.
The test was negative.
No.
AFP and beta-HCG say no testicular cancer.
Okay, so Bechet's theory could definitely still be on the cards. It's fairly rare though, literally 1 in a million prevalence in the US. Much more common in areas on the Silk Road though. About 800 times more common in Iran and 4,000 times more common in Turkey. Maybe they'll realize the patient actually has Turkish heritage now, and that's how they nail it.
How can I tell what's real and what's not? You're obviously not here. I'm obviously not here.
And only actions can cause harm. You refrain from taking any actions.
Okay, so House is hallucinating on how to fix his hallucination problem. It doesn't get much better than that. Now, his solution is that it doesn't matter whether he's hallucinating or not, as long as he doesn't take actions himself and runs all of his idea past his team who are of sound mind. Now, House doesn't have awareness of his hallucinations, but not all people are like that. I treated a 21-year-old girl recently who knew that she was seeing superheroes landing from the sky and that they weren't real. Didn't stop her from seeing them though, and she was using cannabis daily, which can increase her risk of psychosis, so it's not without risk as many people think.
What if we could find a way to do this surgery without giving him more than a paper cut? And make 1 millimeter incisions. You know how small that is?
Just as House said he was going to take no actions, he's operating surgical machinery with Cameron under. House. Presenting the Da Vinci robotic surgery machine, so aptly named since it is a work of art. We currently use it in bladder cancer surgery, and a 2022 study found that it reduced hospital length of stay and improved recovery time by 20% with less complication rates. Also allows you to operate through a smaller incision, leaving a smaller scar. The patients are apprehensive, but House is putting together a little demonstration just to gently persuade him. Who could say no?
Delicate, no?
I think our patient's only testicle will explode if he watches for any longer. There you have it, ladies and gentlemen, how to seduce a woman using a surgical robot. That is the value you get on this channel. How can you not become a member?
Seen enough?
No.
That wasn't a question. You either do this or you die.
You're miserable for nothing. I don't know why you'd want to live.
I'm sorry.
Wow, House really felt that. He was there in the car with the patient's wife as she ended it. He showed now that he is human, which we see from time and time again as the viewers. He might look like he doesn't care or value emotions, but every action he takes shows otherwise, even if he hides it over a tent of wit, sarcasm and insults. What a lovable anti-hero. That's it. House is our anti-hero.
The test results even before you enter the room. But what if the faulty assumption is that it's real? I've lost it.
What? Okay, so there's some Inception mind games going on here. So this whole case is a hallucination. That's why we couldn't figure it out. I still think he's Turkish. Someone get the coffee and delights. We're ready to celebrate.
Why did you stop me?
Because I think you're gonna kill him.
You don't think that. You know it.
Oh, this has got to be a hallucination, because if it weren't, then the next 6 seasons would be shot from prison. Although House has gotten away with a lot in his time, this would push him over the edge. What an amazingly good episode though. Inception level construction and cast dynamics.
Goodbye.
He was shot.
Twice.
Tell Cuddy I want ketamine.
Oh, House's hallucination was figuring out how to cure his own chronic pain for himself. This episode is absolutely off the chain. It has to be there in my top 5. It had more ups and downs than Amsterdam. A huge thank you for Amar Begic, our 2nd ever channel member, for the suggestion. Now it's my turn to diagnose you. Oh look, the treatment's popping up there. Will I get the diagnosis in the next episode? Stay curious.